IV fluids, final exam, and VT&E review. Lactated ringers is our first one. So this is going to contain lactate, calcium, and it is a balanced electrolyte solution. It is isotonic, meaning that it has a similar makeup of the blood. It can precipitate or form a salt with blood products and sodium bicarbonate. So it is not recommended to administer these in the same IV line. Have a separate limb or a separate body part hooked up to a different kind of fluids if you need to administer these into the body. Precipitates are going to be solids that are formed in the vein, which can potentially be lethal. 0.9% sodium chloride, NaCl, and this contains sodium chloride, and it is also a isotonic balanced electrolyte solution, similar to that of blood. Normasol R, this contains acetate, gluconate, magnesium. It does not contain calcium, and it is also a balanced electrolyte solution. Keep in mind when we're choosing our isotonic fluids, the animal's blood work may be something that we're taking into consideration. If an animal is hypokalemic, low potassium, we may want to give a fluid that already has potassium in it, or we may need to use an additive of potassium. If we have an animal that is hypercalcemic or potentially like cardiac failure and we're concerned about calcium levels, we might use something more like Normasol R where it has no calcium in it. So just keep in mind that what these fluids have in them are going to drive what we need to administer for our patient. Fluid additives, 50% dextrose. The routes that is safe for administration, IV or PO. There is some discussion about how effective it is being given by mouth, but there is current research going on about that. Intravenously, remember that we do not give this subcutaneously. If that happens, this can be a concern for skin sloughing, incredibly painful, and not good for our patients. So we always need to make sure that we are reading our fluid bags, because there are some kinds of fluids that already have dextrose administered into it, or we may place dextrose as an additive into our fluids. What other drugs is it added to? IV fluids. So another consideration for our 50% dextrose too is how we're going to run the calculations for this. And the calculations for this are going to be the milliliters. This is the C1V1 equals C2V2. Keeping in mind that C1V1, C2V2, all this is a step later on in that calculation. So I do my little VT&E shortcut here because you guys already have a lot on your mind. Keep in mind in school though, your instructor may require you to do that formula, and if that's the case, you need to follow what your instructor is saying. So we take milliliters times the percent that we want, and we're going to put that over the percent that we have. Keeping in mind our order of operations is very important. And so in this case, I'm going to draw my little, division symbol. So mils times the percent that I want divided by the percent that we have. We always do the calculation of milliliters first times the percent that you want, and then once you have that number, then you will divide by the percent that you have. You don't have to do anything fancy for the percents. And so for example here, if I had 600 milliliters in my IV bag and my vet wants a 5% dextrose solution, 600 mils times 5 equals, calculator, 600 times 5 equals 3,000. And then I will take that 3,000 and I will divide by the percent that we have. Looking at this right here, I have 50% dextrose. 50% dextrose is what we most commonly will have in practice. So 3,000 divided by 50 is going to be 60. So I'm going to use 60 milliliters of 50% dextrose in my bag of 600 milliliters. Keeping in mind as well that I would need to remove 60 milliliters from my 600 milliliter bag, discard that, and then I would add in 60 milliliters of 50% dextrose, and that will make my 5% dextrose solution that my veterinarian is asking me for. Hopefully that helps clarify a little bit. I know that one can be a scary calculation, but once you get used to it, it is super easy. But it takes confidence. All right, Hetastarch, also called vet starch. What does this medication do to the body? This is going to expand our fluid volume. So if we have low blood pressure, this is magical, you guys. It really helps to improve that blood pressure, and it fixes it so quickly. It's one of my favorite confidence builders in practice as well. And it does good stuff for our patients. What condition does it prevent or fix? It prevents, or it will help. It's not hypovolemia, but it's going to be hypotension. So I'm going to annotate right here. So it will help to reverse hypotension. So it will increase the blood pressure. Potassium chloride, also called KCl. This condition prevents hypokalemia, or it will reverse hypokalemia. And it is administered diluted into the IV fluid bag. This is never given IV directly unless we are euthanizing the patient, in which case there are better euthanasia drugs out there ideally. And what happens if we give this full concentration? We can get cardiac arrest and death. This is extremely serious. This needs to be well mixed into the IV fluid bag. As you can see here, red label, concentrate must be diluted before use. The units that it comes in are milliequivalents. So this comes in milliequivalents instead of milligrams. Notice that we have 2 milliequivalents per milliliter. The calculations for this are not difficult, they're just different units. We still will end up running the math very similarly. We don't have to do any wild conversions here. We are just using 2 milliequivalents per milliliter instead of 2 milligrams per milliliter. Different units. Next up is sodium bicarbonate, NaHCO3. And what this does to the body is this is going to help to reverse acidosis. It shifts the pH scale. Remember, low pH is on the 0 end. High pH is going to be on the 14 end. Neutral pH will be around the 7. And this will help to make the blood more basic. It will shift the pH higher. Calcium gluconate is another one. This is a 23% solution. If we were trying to figure out how many mgs per mil this was, 23 times 10 gives us 230 mgs per milliliter. Not a difficult calculation, but it can seem a little bit scary at first. What condition does this prevent or fix? This helps to reverse hypocalcemia, low blood calcium. How fast is it administered? IV slowly. Heparin. Heparin, notice here that heparin is in units per milliliter. And read the instructions because some of these will be administered intravenously, some of these will be administered in the IV bag, and some of these will be as a flush in a syringe for IV. Notice that this says this is not for lock flush, so this is not intended to flush the IV catheters. It helps to prevent thrombus formation for part of our treatments. And there we go.